Welcome to The Hair Loss Show, where two of Australia's leading hair restoration surgeons, Dr. Russell Knudsen and Dr. Vikram Jayaprakash, discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everybody, I'm Dr. Russell Knudsen.
And I'm Dr. Vikram Jayaprakash. Welcome back to The Hair Loss Show.
Guys, one of the topics we're going to discuss that we get asked a question about a lot of times is if a patient declines medication, which is their right, would we still operate on them? I think we can safely tell you that the answer is yes, but the but is that we would then spend a lot of time on education about the consequences of it. It's not compulsory to do it, but it has certain consequences that need to be explained fully to the patient.
Yeah, and I think that's really when we're consulting with a patient, one of the things that I know that we both do is we both sort of silo them into two separate buckets, which we're going, medication is designed primarily to stop the progression of hair loss, right? It's not if you're completely bald, you know, you can take all the finasteride, whatever other medication you want, you're not going to come back with a full head of hair. No. So it's about stabilizing. It's about getting that message across that they do different things. It's not, oh, I want a permanent solution. I don't want to take medication on a daily basis. I just want to have a hair transplant. So I think, I mean, do you find this is what you spend a lot of time sort of unpacking that and
so I have two ways of explaining it. The one way I explain it is to tell patients that they should think of hair loss like leaking bucket syndrome, and they're leaking hairs out of their bucket. And what medication is designed to do is to fix the leak. Yeah. Right? Because all surgery does is top up the bucket. So if you top up the bucket without fixing the leak, you know that you're going to have to top it up again. When I came into the field, a long time before Vikram, by the way, there were no medications at all. So the deal was you lost some, we gave you some. You lose some more, we give you some more. We lose some more, we give you some more. And we would have, my patients would come back to me often every 18 months or 2 years for top-ups because you were trying to keep pace with the further hair loss. Since the advent of medication, the interval between people needing to come back is now out to 5 to 10 years. It's a huge difference, and it makes a number of different advantages to the patient for that to be true, apart from the hassle and the cost of having to have multiple operations. But the other way I explain it to patients is to say to them, the worst thing that can happen to you if you stop medication or you don't take medication is you will bald naturally as nature intended. The worst thing that can happen to you after we operate, if you don't take medication, or if the medication isn't completely effective, is that you will now bald unnaturally. So a patient coming in with recession at the front here, and we fill in a triangle, and we fill in a triangle here, and then they lose the middle or they lose it in behind, gets a GT stripe, that's not a natural pattern anymore of baldness. People where we operate in the crown, where the area in the crown enlarges later and goes out sideways and down at the back, end up with an island.
Yeah. So if this is the top of the scalp and you fill in the crown and that looks beautiful, right? And that's perfectly fine. That hair ostensibly is not going to fall out, but what is going to happen is potentially if the balding continues, then the margins will move out in a radial fashion. So you're then going to have this, like you said, a halo effect where you've got hair in the middle and then a bald ring around it.
That's not a natural pattern. So that's the consequence that patients need to understand. So this is particularly important for the younger men who have crown balding, because that is the thing that bothers them a lot, apart from the hairline. We see it so many times now with people coming back from other clinics overseas or interstate, and they have this massive amount of grafts put into this balding crown and at the age of 25 or whatever, without understanding the consequences of what happens later on, where we're going to have to chase the border to do it.
So I think there's 2 points to that, and if I can follow on with that, which is that it's not comparing apples with apples, because what you talked about before there was medication and you were doing regular top-ups, the graft number was relatively small, right? But now the graft number, the expectation of graft number is much higher, and we can talk about that later. But that's another thing which sort of cloudies the judgment, which is that, right, if we're getting more done, you're going to run out of donor. And the other bit that I'm interested to hear your point on, your view on, is that the number of people that I've heard going, I don't care about later on, all right? It's my hair right now that I want to keep, all right? When I'm 40, when I'm 50, I won't care as much. And the reality is they all care when they hit. I mean, you know more, you know better than me that, you know, you followed them through from age 20-something, and they're now in their, you know, 50s. They still all care. And part of that has to do with it doesn't look natural if you do bald, you know, in an unnatural, or you're left with an unnatural look.
Well, that's right. And then, you know, back in the past when that happened, they just used to shave their heads.
Yes.
But unfortunately, with the older style big grafts, which thankfully we don't do anymore, even if you shaved the head, it was still obvious that something was weird going on. And, you know, the most obvious example of that to me is the Edge from U2,
Yes.
who had big plugs put around the front, and he shaved the head, but they're still obvious that he's got big plugs there, which is why he wears a cap every time he's performing. He won't expose his head. So there are consequences. And so the thing about, we will operate, but we need to be very cautious about it. And to me, the crown is the real danger area if we're going to operate on a patient without medication, because you can fill up the front and you'll always have enough grafts to do the front, right? It doesn't matter how bald you are, you're usually going to have enough grafts to do the front. What you don't have enough grafts is to do the front and the back necessarily. And so I think that one of the ways I explain to the patients is, well, let's just deal with the front and see what happens as we go along. I mean, I know you're upset about the crown, but that's where you can get yourself into a lot of trouble by using a lot of grafts and then ending up looking wrong. So let's start with the front, because that's what people see, right? And that's going to make the most visual impact for you. And let's try and preserve grafts because you're young. Now, it doesn't matter so much if you're 60, right? Because if they don't use medication at 60, how much more hair are they going to lose?
Yes.
They might lose a little bit, they might lose a moderate amount, but they ain't going to lose a huge amount. But if you come in at 25 or 30 or 35, you've got 40, 50 years of balding in front of you. And so, again, it's also a function of the aggressiveness of the baldness, which I talk about all the time.
Yes.
Which is, if I see a patient at 35 with a small amount of hairline recession, no strong family history, we've examined them, there's nothing much going on, he's got less risk. If I see someone in with early thinning through the entire scalp and he's young, a lot of risk.
By definition, just with the age group, you're already going to put them into that category of an aggressive balder. And therefore, not being on medication at that point, or electing not to take medication, is going to be
I
difficult.
I always say to patients as well, if you have to think your way around this. If you think you won't care at 40, you're married to 3 kids, you don't care, you just care now, then just medicate. Right? Because when you don't care anymore, just stop taking the meds and let nature take its way through you.
Yeah.
But if you start operating in your 20s, you're going to have to care about your hairline and the hair for the rest of your life. There's no walking away from it, because it might look quite unnatural.
So I think the summary of the whole thing is, yes, we probably, we'd never say no, you can't have surgery, but we'd spend a lot of time.
And we have to set realistic expectations about what outcomes are going to be like, and then let the patient make the value judgment, because there's risk versus reward in that situation.
And it also comes, like you said, it also then comes down to hairline design, not going too aggressive in that.
Well, the lower the hairline, the more grafts you're using anyway. So, there's a lot to think about, and I don't really expect patients to make up their mind on the spot.
No.
I like them to go away and have a careful think about it, because that's really what we're trying to say. This is an important decision for you to make. They come in a panic because they just want it fixed yesterday.
Yes.
But they need really to think through the consequences of their action, because impulsive decision making you can regret in a very, very careful, long-term manner. Yes,
absolutely. Right. Cool. I think that's a great point of
Hopefully that helps you explain to you why it's so important to have a comprehensive evaluation and consultation before you commit to surgery. And you really need to talk to the doctor who may be performing the surgery and get his take on what he thinks is going to happen and how it's best managed to produce the less risk to you, the patient.
Absolutely. So yeah, I think it takes a lot of thought, and it's not. I think that's a really good point. That it's not a fast decision. It's something that needs to be thought through, especially if you're considering surgery and not open to the concept of medication. Then you have to all the more have to make an informed decision based on that. All right, we'll see you on the next episode. Thanks again for watching.
Keep subscribing and keep watching. Thanks, guys.